All right, welcome everybody. This is David Rutz. We're on YouTube. This is titled the DAC's Flat Fee Pharmacy Program Introduction. So very excited to have all of you here today. A lot to talk about, and I'm excited to cover with you. We've got a couple guests that'll be joining as well from our new partners. But listen, I just wanted to congratulate everybody who's taking the time to be here and watch all those on YouTube, and anyone watching this recording. Thank you. Again, my name is David Rutz. I happen to be the founder of DAC. I'm very excited about this product rolling out. We've been working on this for quite some time, and we think it's a fantastic fit for people who are self-employed like yourselves. An amazing product it represents. It can be a significant income producer for you by providing a significant value to the customers. So let me tell you a little bit about it, and then we'll have our guests join in. DAC's Flat Fee RX basically is this. It's like the Netflix model teaming up with pharmaceutical, where a customer will pay a flat fee, one flat fee per month, and get access to all the pharmacy products that are available for free. And so an individual or a family plans under $30, individuals under 20. And when a customer signs up for it, there's a list of hundreds of pharmaceutical medications, most of which cover most pharmacy prescriptions out there. Over 90% of prescriptions ordered are covered on this for free. So what it allows is for a very reasonable way for a customer to see quickly, hey, are the pharmaceutical medications I need covered on here? If so, they'd be free. Great. Is my monthly cost lower than what I'm paying? Great. Then I'm going to switch to this. I'm going to get this pharmacy plan, this membership with DAC, and get my medications free. And there's so much more to that. There's so much more to it than that. But it's also a residual income producer for all of you. You're all independent business owners. As you know, we have great business services that help business owners with funding or payment processing or healthcare. We've got a great consumer healthcare product we just launched. And now this pharmaceutical product, which can come alongside of anyone's current healthcare program. They don't have to be uninsured, and they can be insured. This is not insurance. This is a membership to save you money on your prescriptions. Not only is it prescriptions, your chronic prescriptions like blood pressure and high cholesterol things, or diabetes medication, things like that. Not only is it those chronic medications, but it's also got acute medications, meaning one-time prescriptions where you have a bladder infection, you need antibiotics. The doctor gives you a prescription, you go to your local CVS or Walgreens and you get your prescription. It even covers acute medication, one-time things like that for free. It even covers your diabetic medication. It even covers discounts on insulin. So it's an amazing membership. You're going to learn more about it now, but we believe our goal is to have over 1 million people covered with this by the end of 2024, over 1 million. That's our goal. It's our stretch goal, but with the size of the organization we have and with the interest level we've got and with the size of the problem that exists, with pharmaceutical medications going up, the average family is spending over $1,000 every single year, $1,600 I think it is a year on medications that we can get them for free for a $20 individual or $29 family plan monthly. I mean, that's just spectacular. And that doesn't count the acute medication. So we've got a giant need out there. It's very confusing, and we're bringing simplicity. So before we bring on our guests to tell you a few things, I wanted to share with you how this came about. And we've been wanting to launch a consumer-based product. We've had other discount programs we've looked at, but we've wanted to do a Netflix-type model for the pharmaceutical industry for a while. And we've even talked to some other companies. And we've been mentioning this to all of you for months that we wanted to bring a product forward. And we just couldn't ever get it across the start line. Because as we look deeper and deeper on things, either companies didn't want to deliver the product the right way or didn't want to deliver a lifetime residual on the customers and didn't want to survive any mergers or acquisitions or buyouts if they were ever purchased. There's certain things we require before we'll launch a product. And so we just couldn't bring it to the finish line. And or the start line, we had one company that we got real close. We even built out our websites and got everything ready to roll. But in the final hour, there was just a couple curveballs thrown at us, and we said it's just not the right fit. It's just no longer the right fit. So we literally I wrote down our wish list of what we're looking for in a company. I wrote down the wish list of what we'd be looking for in a pharmaceutical company. I started reaching out to pharmaceutical companies directly and heard back immediately from this company who we've partnered with. See, we're not a pharmaceutical company. We don't want to get into pharmaceutical distribution business. There's so much regulation in that in every state. But we did want to find a national pharmacy that can deliver pharmaceutical medication in every state and has been doing it and has already gotten out all the kinks. And we wanted to find that company. We wrote a wish list. We said, hey, we've got the idea of bringing Netflix model, the one price model, to the pharmaceutical industry. And we believe by law of large numbers, by getting millions of families and millions of individuals, we can bring a profitable model for someone. And we wrote up a summary page. And I sent it to these pharmaceutical companies, and I heard back from this one. I said, not only do we like your model, not only do we agree with your model, we're already doing it. I was like, you're kidding. And so as I learned more about this company, they already had this vision a couple of years ago. They've already for 7 years been doing direct-to-consumer pharmaceutical medication. But we're bringing this flat fee pharmaceutical product to the world, to the nation anyway. And this is an opportunity for all of you. Before we get into the product a little bit more, this is an opportunity for every single one of you to build a significant residual income, because this is a viral product. This is our business funding. We've got people got started to make 10 grand the first month by helping someone get a business funding. We've had people make 15 grand on one funding. We've had people make 30 grand on one funding. We've had people who've been with us a year and never gotten anyone at funding, right? So there's great upfront money in our funding product and great residual in our other business services. However, it's a small percentage of the people who will do very well at a B2B, business-to-business product. So for 5 years, I've been looking for a residual consumer-based product that can help drive the residual incomes of every one of you who are involved in this business. Some of you know my past, I used to market long-distance phone service back in the 90s, and that was a contagious residual service that was very easy to put up hundreds of thousands of customers if the product was remarkable. Because the average person could get 10 or 20 or 30 or 50 customers if it's a remarkable consumer service, right? And this product is the most remarkable consumer service I have ever seen in my 30-something years of direct-to-consumer marketing. This is going to become a game changer for our industry, for our company, certainly, and we think this is going to end up being a wave, a monsoon, where there's going to be many other companies who say, we need to have a product like that and take it to market through the direct sales business, because you'll see how viral it is, and there's nothing better for retention of residual income than it's a remarkable product that really saves people money, and the demand is going up, 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 up. You can't turn on the television without having somebody talking about healthcare costs, especially right now. And when you couple this with our new Clearwater ClearShare healthcare plan that protects people better than their health insurance at a fraction of the cost, we've got a 1-2 punch in the healthcare industry that's second to none. And you know what we've discovered? When we have products like this, our recruiting numbers go way up. And when the recruiting numbers go way up, guess what happens to funding? It goes way up. Rising tides raise all ships. Rising tides raise all ships. And guess what? Tides that go away sink all ships. And so the good news about this is a rising tide. This is a product that, again, we believe we can help over 1 million families get covered in 2024. How many of them will be in your team? How many of them will be your personal customers? Because you get a residual for the life of the customer, not just on your own, but on your team. So that is the great news about what we've got here. What I want you to know more about the product, though, I'm going to tell you a little bit about it, and then we're going to bring our experts on. Your website's already live. DAChealthcare.com is the direct link. DAChealthcare.com. That'll take you to our new healthcare page that launched last night that you can now direct people directly to with your replicated link, dachealthcare.com/your ID number. That'll take them directly to the site. Not only does it have the healthcare individual plan and group plan, it's also now got this flat rate RX plan. And we partnered with a direct to consumer pharmaceutical company. So this isn't new for us. The partnership's new, but it's not new for them. It is new for us, but we've got a solid, proven company doing the distribution of this product, which we're very excited about. We're even using their checkout. We're even using their onboarding system. We're even using their email welcome membership packet. So rather than putting in our own brand and slowing it down and having inconsistencies there, we said, let's use a brand that's been out there for years. So you have access to the best price in this. So there's some others who use these guys at wholesale, but they all charge more. They all charge more. You've got the lowest price available on this product, the lowest price available. And if anyone else is marketing it, they marked it up and they're charging more, marketing the same service. It's like if I had Verizon phone and I can get Verizon at $50 a month, and I say, well, I'm Verizon as well, but I'm called Zuby-Doo Cellular, but I'm charging you $60. You say, why wouldn't I just use Verizon for $50 if you're using Verizon and charging $60? It doesn't make sense. We said, why would we upsell? Let's market at the lowest available price there is, and that is by partnering with the people that innovated this. So we've got the innovation. We're the ones bringing it to market, and you get to bring it to market and make a significant residual income by sharing it. So dachealthcare.com/your ID number. If you want to go directly to this pharmaceutical, it's dachealthcare.com/RX/your ID number. All right. So our welcome letters will be updated to have this information sent to them. This is a beta launch for the next 2 weeks until December 1st. Beta launch means there may be a kink or two. So we want you to know that going out. Marketing, all the materials for marketing isn't live yet. We're working on all that. The pay plan chart has been updated to show the residual revenue and all that. But we're going to, over the next 2 weeks, really be ramping up the marketing ability for you to get out and share this. But I will tell you this. I put a little post on my website, and I just put a little prescription bottle cartoon and said we've got an innovative product launching soon. If you're on my Facebook, you'll see. That is the most responsive Facebook post I've done since we started this company, and all I did was post that it's coming. People that have never reached out to me in my friends group, people in my in messages, and I've had more in messages for this product than any other product I've mentioned. And all I did was say it's coming soon. So there's a demand out there, folks, and this is a unique way of distributing this product. It's innovative, and I wish I could say it was our idea, because we did write down the idea to do this. They're already doing it, which is okay. We don't mind that they're already doing it. We didn't have to create the idea, but we can be the ones to bring it to market. We can be the ones to put millions of customers up on it, right? And do you mind if someone else was doing something? And could you imagine right now if you met Netflix before everyone knew who Netflix was, and you heard this innovative model? Are you kidding me? 1 monthly price, all your videos free. It's brilliant, right? Y'all know it's brilliant now, but when it first came out, Blockbuster's like, yeah, whatever, we're still the pharmacy. We can still sell it one at a time at the prices we want. Okay. How's Blockbuster doing today? So you're going to learn more about the product, but I just want to tell you this. You get, by the way, is our guest here, Avery or Les? Are either Avery or Les here yet? Let me see if our partners are in. Morgan, Sharon, Tyler, anyone?
I do not see them as of yet.
Okay, well, we'll just keep going. They told me this morning there's a chance they may not be able to join because of they're with our partners. They have an insurance company and they're working on some big things, and they said that we may not be done in time. So we're looking for them. We'll keep an eye out. Sharon, Morgan, Tyler, if you see them, just let me know. Otherwise, I'll just keep going. I'm going to share some screens. So here's what you need to know. Your website's already got a frequently asked questions. Your website's already got all the information. But here's what's key. When someone pays one flat fee, it's under $20, $19.95 for an individual, $29.95 for a family. They can buy an annual plan and save a month. Okay? If someone buys the $19.95 plan, what they would want to know is what's covered. Are my prescriptions covered? Right on our website, we have a pharmacy lookup. They can look it up, look up every prescription they take and see if it's covered. If so, they go pretty simple, $20 a month, and I've got all my pharmaceuticals. If I spend more than 20, are my prescriptions covered? Away we go. Families, $30. Okay, so we have chronic, which means ongoing subscription to a prescription, like blood pressure, statins for high cholesterol, diabetes medication comes every month, right? That's called chronic. Almost over 90% of chronic pharmaceuticals are covered, over 90%. So it's like saying, hey, does Netflix have any good movies? Over 90% of the movies made are in it. What? Well, what about, this one that just came out? Well, maybe that one's not in Netflix yet, right? But that doesn't mean it's not of value, right? So most all prescriptions that have been around for a while are in this for free. Now, that's called chronic. If there's a chronic medication that's not listed, usually it's a brand new, not yet generic, then there's a discount and you get it at your local pharmacy. If it's a chronic and it's listed, you get it for free, shipped from the online pharmacy, right? So they ship nationwide, free shipping. So you have to order, you have to subscribe through getting your prescription sent to your membership, and then it's shipped to you. And then it's ongoing ship, okay? So you don't go directly to the store to get it. If it's a chronic medication that's part of your free, you get it from your online prescription, all right? If it's a chronic, but it's not free, let's say it's a brand new drug, and your doctor says, you gotta have this one. And you're like, well, doc, is there any way I can get one of these? Because these are all free. Nope, it's gotta be this drug. Okay, then you go to your local pharmacy and you get a discount on it based on your membership, right? So if it's part of the free, you get it free, as long as you get it mail orders. If it's not free, you get it discounted at your local pharmacy, all right? So that's chronic. Now, acute means a one-time prescription. Think like you need an antibiotic because you have a infection, and so you need an antibiotic. Now, there's a group of acute medications that are free, and there's a group that aren't free. Okay, same thing. So most all are free. Some aren't. The most all that are free, those, because it's acute, you do go right to your pharmacy and get it, and you get it for free at your local pharmacy. So chronic must be mail ordered for free. Acute, though, you pick it up right at get up to a 21-day supply right at your pharmacy for free, if it's on the list of acute medications. Give an example. I've been using this and testing this for a while. My daughter had a antibiotic she had to give, but it was a cream. The cream wasn't part of the free formulary. The pill was. If she had gotten an antibiotic pill, it would have been free. So if you tell the doc, hey, the cream I don't get free, I have to pay for that. The pill I get free, can I get the pill? So it's good to know these things, and of course, you get the antibiotic pill or cream, it doesn't matter. Potentially doesn't matter. Depends on the need, right? So this is as a customer, I want you to know these things because that way you don't set improper expectations with your clients. All right. So not every medication is free, of course, just like not every video is free on Netflix, but most are. I mean, most that are available, over 90% of prescriptions chronic are covered for free, and same with acute. But if you got one that's not, you go to your local drugstore and get it at a discount. Okay? That's acute and chronic. Now let's talk diabetic. Diabetic, if you become a member, if your customer becomes a member, they get it, and they're diabetic, they get a diabetic kit for free, which is your blood glucose reader, your lancing for getting the blood, some strips that you have to put in, and you also get the lowest price on insulin, and you get the lowest price on insulin, and you get the lowest price on insulin vials and insulin pens. All right, so insulin vials and insulin pens, lowest price available on the market, and you go directly to Walmart for that. So because that has to be refrigerated, you actually have to pick it up. So there's partnerships with Walmart pharmacies all throughout the country, and you get the lowest price. So if they're a member, they have free chronic shipped to them, ongoing. They have a discounted chronic if it's a brand new medication that's not part of the free formulary yet. They pick that up at the local location. Then they have the acute free. You go into your local pharmacy, show your card, get it free. Or you have acute, which is not on the free list, and you get it discounted at your local pharmacy. Then you have diabetic, you go to Walmart pharmacy to pick up your lowest price on insulin vials and insulin pens. And then you also have a free diabetic kit. Okay? It's all part of the membership. One other thing, over-the-counter drugs, Tylenol, Advil, Robitussin, over-the-counter medication that you can go to buy at any CVS is on average 50% off or higher. And on your website, you'll see some of the prices. You'll blow your mind. That you can't go to your local store to get. They have to be shipped to you from the pharmacy. Okay? And they're shipped to you from the pharmacy one of two ways. One, you just add it to your ongoing prescription that comes out, and it's free. You just pay, you get half off or more. And you just ship it right with your prescription. Okay, that's number one. Number two, you buy it and you get it free shipping if you spend $25 or more on these over-the-counter drugs. Okay, so they're not free, obviously, but they're deeply discounted. So if you want to buy some Tylenol and some cold this or that, this or this, that, you know, omeprazole for heartburn or Zantac, you know, all those things, you get it for half off or more. So if you're going to get that every month anyway, just get it on and have it shipped with your other stuff, right? If it's not a prescription. If it's prescription, it's free. It's pretty cool. So those are what you want to, that's the best understanding I can give you. Now, I think I just got a call from our friends. Okay, they are saying they're here, but they may not be signing as their names. So,
Hello? It's Avery.
How are you, Avery, how are they? Find you good, beautiful.
Yeah.
Thanks, Avery.
I've been in the video the whole time, but the host was controlling the mute, so I was kind of stuck with my hands behind my head.
Yeah. He didn't. I told him to look for Avery or Les, so they were probably looking for Avery. So I'm glad you were able to communicate who you were, Avery. You can hear our excitement, obviously. I don't know how long you've been
Absolutely.
on. All right, so we're just so grateful for the partnership. We love the fact that you guys created this product and you've been marketing it. And we want to bring a lot of horsepower to it, a lot of excitement, and a lot of agents to help a lot of customers, right? So why don't you fill in from anything that maybe I was a little off on, maybe even bring more light to it, and give us a little back about your company.
Well, David, so far you've done a perfect job of explaining the program. The Netflix model is really what we are. You know, as David mentioned, it's a small monthly fee. We cover 805 drugs. It's the top 90% drugs in America. These are the most utilized drugs that people are actually taking. So these aren't loss leaders or, you know, drugs that, you know, people are not taking. This is what the everyday American is taking. The program is very simple, just as David has alluded to and shown you all. There's 5 categories once you become a member. The acute medication, immediate need. You know, the perfect example is you have the flu. You go to the doctor. What happens 10 out of 10 times? You drive straight back to the retail pharmacy that you've always been going to because the doc wrote you a script for an antibiotic and you don't have time to wait. You want to zap that flu out of your system. So you take our membership card in 64,000 pharmacies in America. It doesn't matter if it's Walgreens, Rite Aid, CVS, your grocery store, a mom and pop pharmacy. We're accepted at every pharmacy in America. You present our card and you're getting that acute medication for free. And acute medication is just, you know, like I mentioned, it's something that's short and quick. Usually lasts anywhere from 5 days to 21 days. Anything over 21 days then becomes a chronic situation. So antidepressants, heart medication, stuff like that. That's what we ship to the member free, next day delivery into your mailbox. That's important. A lot of people are concerned with, you know, like the Amazon drivers or UPS, they're flinging their packages, you know, on your front porch or next to your garage, and you might be concerned that somebody swipes your package. Well, obviously it's a federal offense if somebody goes in your mailbox. So it's nice, safe, and secure. You know you're getting your medication. We deliver you the chronic medications in a 90-day supply, so 3 months. Usually, if you're a chronic user, you're getting your medication at a 30-day supply. So giving you a 90 days is quite a significant jump. At day 70, we know in our facility at day 70 of your cycle of your chronic medication, we start to reach out to you 3 times via text message and say, hey, David, it's day 70. Look like you're coming up for a refill. Would you like to get that? Yes or no? If you don't respond within 3 text messages, we actually have a live white coat pharmacist call you and go, hey, David, you didn't respond to our text messages. We just, want to make sure everything's okay and get your refill. And then it's coming to you next day. Usually, the chronic medication is coming to you, within a 10 to 20 day lead time up until your next cycle. The third category, OTCs, top 30 OTCs in America. We actually have 10 of the top vitamins and minerals. We know that that's a very important in a health regimen of an American. We give these to the member at cost. So on our program, a bottle of Advil, a 500 count is $3.99. It's a tremendous savings and add-on for the member. The reason why these are not free is because, if we were giving away free Advil, people would be ordering 20,000 bottles and they'd have their own thriving Amazon business just selling our Advil. So it's just a little add-on for the member. The fourth category, diabetes, arguably the biggest category. So I like to paint this hypothetical picture. So for the small price for a family, let's say there's 100 people in the family and they're just paying that one small price, not per belly button, it's per door. So one small fee for the family, there's 100 people, and let's just say, unfortunately, all 100 people are diabetics. All 100 people that are recognized as a diabetic are going to get a free Lancet strip glucose monitor solution. Usually those starter kits can run anywhere from 50 to a couple $100. Now there's no reason not to test and manage your disease. Diabetes is actually a very manageable disease. What's unfortunate is they price it so out that people have to make decisions between rent, food, everyday household budgets, or even getting your testing supply for diabetes. And we just realized that it doesn't need to be that way. So we give the member no excuse not to test. So all the free diabetes testing kits. We give you the top 12 oral medications for diabetes for free, metformin, glipizide. There's a lot of tongue twister names, but there's 12 of them. Get those for free the entire time you're on the program. And we have the lowest costing vial of insulin in America at $19.95 per vial. And usually a diabetic is using several vials a month. I'm sure some of us saw several months ago the government put a cap on insulin at $35. So believe it or not, we're actually coming underneath what the government did. So it's a tremendous savings there. The fifth category is pharmacy coaching. So we have 10 white coat pharmacists on staff at all times. Even though we're a quote unquote mail order facility, we like to act like your neighborhood pharmacist. A pharmacist is the top 3 most trusted profession. 9 out of 10 people go to a pharmacist before they even go to a doctor and ask the say to the pharmacist, hey, these are my symptoms. What should I do? All those good questions that you have for a pharmacist. We act the same way. You call us, you call our customer service department. They transfer you over to the pharmacist. You can ask them any question about drug interaction. Do I take this with or without food? But one of their big jobs is EasyRx transfer. So once you become a member and your scripts are at the Main Street Pharmacy right now, we reach out to you and we say, hey, David, you're a member of the program. We'd like to transfer your scripts over to the free program. Do we have your consent? You say yes. We show you the savings. And we do all of that laborious paperwork transferring your scripts from your current pharmacy over to us. They make that very laborious and difficult for a reason, because the retail pharmacies, they want to keep you as a member, but they're also gouging you. And now we're giving you your medication for free. I know this question will be asked, so I'll just address it now. Well, you said the top 90%. What about the next 10%? Those are brand and specialty medications. If you've ever seen a commercial, doesn't matter if you're watching a sporting event, a Hallmark movie, the news, seems like, drug commercials are everywhere. And actually, a fun fact is the United States is the only country that's legally allowed to advertise drugs, and you can't just go buy drugs. So think about that for a minute. That you see a advertisement for Humira, but you can't just go to the store and buy Humira. Doesn't really make sense, but they do that for a reason. All those drugs are extremely, extremely expensive, and we have a solution for those. So we put members through what's called a patient assistance program. If you're one of those people that are on a specialty medication or a brand medication, our pharmacists do the paperwork for you. We get you eligible for a specific patient assistance program. 9 out of 10 times, we can get that drug for at least 50% off, or in some cases, we can actually get it for free. So that a lot, like Humira, for example, is $5,000 a month. Nobody can afford $5,000 a month for a drug. That's just absolutely ridiculous. Now we have a solution for that. Not free, but if we can get you a greatly reduced price, it obviously helps. So that's really the program quickly in a nutshell. A little bit about us. We've been open since 2017. My father is the founder and CEO of the company. Way back in the day, he originated the concept of a discount card, so something like a GoodRx. 30, 40 years ago, those worked and they were great for the consumer. Now they're not worth the paper they're written on. They're just misleading the American consumer. They're advertising that a drug is $3. You walk in, next thing you know, the drug is $60, and you're left scratching your head going, well, I thought it was $3. And now you have to make that decision of, well, I need to get gas, I need to buy food, I need to pay rent, all the daily expenses. And I thought I was going to pay $3, and now it's an extra $57 that I just don't have, or I just don't want to pay. So then that becomes an abandoned script. And we see about 30 to 40% of prescriptions are abandoned at the retail pharmacy for a ton of reasons: access and cost. Now with this program, we eliminate both of those things. The cost is free. Obviously, you just pay the small membership fee. And now access. We joke around our office that the only thing we don't do is actually put the pill in the member's mouth. We pretty much do everything else. So delivering it, in your mailbox, you just sit back, relax, enjoy your day. Now you're getting your prescription meds for free delivered to your door. You're a happy, healthy customer, and you're saving a lot of money. So I'd like to answer any questions, or if there's any areas of the program, David, that you'd like me to kind of expand on. I'm happy to do that.
Well, Avery, it's a pleasure meeting you, by the way. I've had great conversations with your father, and I'm glad you shared that he's your father.
Yeah.
I knew you had the same last name, so I didn't know if you were how you were related. But when I talked to your dad the first time, I could tell that there was the passion behind starting the company wasn't economic. I mean, I'm sure you want to do well financially, but he shared over and over the frustration he had about how much drugstores are making on people, and how much. Well, can you touch on that a little bit about when you just said they're gouging at the local? I thought CVS was giving me a price that the pharmaceutical company said, or I thought Walgreens was giving me a price that the pharmaceutical company demanded. I didn't know that they were marking that up. So can you just touch on why your dad started this company? And I know you mentioned it, but that spoke volumes to me when we decided to partner with you guys.
Yeah. So obviously that was a big reason why he went in and started this business, because like I mentioned, he was kind of an insider in the pharmacy industry the last 30, 40 years. And I see that there's a little over 200 people on this Zoom. And if I ask, who do you think controls the price of the drugs, the manufacturer or the pharmacy? I would bet 90% of you would say the manufacturer.
Mm-hmm.
That's wrong. It's the retail pharmacy. We are all, so we're licensed, we're a pharmacy, we're licensed in all 50 states. So is CVS, Rite Aid, Walgreens, Publix, Albertsons, wherever you're located. I'm in Ohio, so if anybody's from Ohio, Giant Eagle, all the Ohio grocery stores. But we're all buying these drugs for 2-3 cents on the dollar. CVS, Walgreens, and Rite Aid is buying that 2-cent pill, and they're electing to sell it for 40, 50, 150, 200 bucks. Why? Number one, it's because they can. And number two, we're conditioned as pharmacy consumers. We just accept that that's the price. Has anybody noticed that pharmacy is one of the only products and industries that doesn't have number one, it doesn't have a set price list. You can't Google, what's the average price of this drug? And there's also no menu board. When you drive to McDonald's and Burger King, you know that a hamburger is going to cost you $1 or $2. If you take a prescription to a corner and there's a Walgreens, Rite Aid, CVS on all 4 corners, you're going to get a different price at every single pharmacy. CVS might be $40, Walgreens might be $50, Rite Aid might be $20. And they control what they sell it for, and they do that for a reason. So my father was just sick of that, sick of the games, sick of the end consumer, the American, being gouged. There's no reason why a 2-cent drug needs to go for several $100s. Our biggest therapeutic class is antipsychotics and behavioral health medication. These are that's a chronic medication. These are medications that people need to get through the day. And we all know mental health crisis going on, all the things going on in the world. Wouldn't you think that those people would get a break for their drugs and they'd be able to afford and get access to medications that they need every day? Duloxetine, one of the highest prescribed antipsychotics, if you're a cash paying consumer, it's $500 a month, 30-day supply. So do the math times 12. That's a lot of money. People just can't afford that. Now we completely wipe that out. People are getting that medication for free. They're happy, they're healthy, and they're getting it at a 90-day supply. So it's
that
we don't.
That was eye-opening to me, Avery, when your father shared that with me. Completely eye-opening because I thought it was the manufacturer. And I love the pricing model you guys came up with because you guys created this Netflix model type thing. And that's why we've been able to fast track this, folks. Some of you know that we just started working with My Free Pharmacy in the last 3 weeks. We've been trying to put this together for months, and we didn't even know about this organization. And I feel it's divine that we've been brought together, Avery. I'm real excited. Other than that, I'm a Michigan guy or an Ohio State guy. Other than that, there's Nebraska, I believe. So,
I'm born and raised in Ohio, but I didn't go to Nebraska. The school I went to didn't have football, so I'm technically a Cornhusker. But
okay, well, we have a lot of fun, and I see our partner with Bank Greasy, Wade Cordell's on. Wade, we're going to ask if you got a question. I'm going to add you here. And Wade's a Clemson guy, but we don't need to get into football right now. Yeah. How are you doing, Wade?
Hey, listen, this is, oh man, I've been talking for a couple of months to places that I've already got set up, like doctor's offices, pharmacy offices, and all that, and dentist offices that man, all I got to do is put a QR code there, and they're all on it. But the question I have for you, it's amazing to me what you can do with the insulin part, because it has affected a lot of people in my family. And the one thing I want, and I'm assuming that since you have all the package, the starter package, and all that they need. What about the insulin? I just went blank. What is it? The shot, not the shot. What do you call it? Pens? The insulin pens.
Yeah, we have insulin pens. I believe our insulin pens, so our standard insulin that covers about 80 to 85% of diabetics is $19.99, but our pens are about $37. So
okay,
still, if you're buying those pens, they're way more than that. They're in the hundreds of dollars. So $37 is a tremendous savings for
it really is
insulin pen.
Okay,
thanks. Thank you, Wade. And by the way, do you go directly to Walmart to get those? Is that correct?
That's correct. Yeah. So we contracted with Walmart for all of our diabetes supply. So there's virtually a Walmart on every corner. So if you're diabetic and you need the insulin, you just go to Walmart to get it. We ship you the oral medication and the diabetes kit, but the insulin you go through Walmart.
Okay, fabulous. We've got a few other hands up here, so I'm going to defer to Morgan or Sharon or Tyler to lead the questions. But while they're getting those ready, let me just share this. When someone joins, folks, they join, they pay right then. They're going to be paying My Free Pharmacy. That's the brand that we've co-branded with. And My Free Pharmacy is the one who's going to bill their credit card. And then the next day, they're going to get a welcome email. So they get a welcome pack. It starts around 4:30 in the evening. They start going out next day. And that's when you get your digital welcome kit and your digital card. And immediately you can start moving your prescriptions over already. It's effective immediately. You don't have to wait till the next month or anything like that. As far as DAC reporting in your back office, there's going to be an API integration. So it'll be that same day you'll start seeing those customers show up. And we're working on trying to make those real time, where every time someone orders, they'll show immediately in your back office. But that's not the case now. It'll be daily. But it won't be next month. It'll be next day that it'll show in your back office. But let's go to the questions that we have for Avery. Avery, how much more time do you have?
As much time as you need.
Oh, wow. Fabulous. We appreciate it. So,
All right.
questions. What do you got, Morgan?
Yeah, we've got Jose. He's unmuted. You can go ahead with your question, Jose.
Okay, good morning, gentlemen. My question, I have two questions. One is, I think David just answered it about billing, and would that be like a credit card or something that y'all would have on file? That's my first question.
Yeah, what happens is you put in a credit card to order, and it's billed, the credit card is billed on a monthly basis or annual if you bought the annual plan. You get a month off if you buy the annual plan, you pay 11 months instead of 12, but you pay it up front. Yeah, it's billed on a credit card and each month on the same day.
Okay, my second question is, so I go to my doctor today and he says, well, Jose, now you need this. How do I get that to this company, the prescription company?
Yeah, I can handle that, David. So you have our membership card, and even though we're not insurance, there's NCPDP numbers that all the pharmacies use to e-prescribe a medication. So once you're done with your visit, you go to the tech and they say, hey, are you still at Main Street Pharmacy? You go, no, I'm on this program. You hand them your card. All the information is on the card. The tech knows what to do. That's their job. And they just electronically sit on their computer. They send the script to us. And 9 out of 10 times, that script is sent to us, filled and bagged before you're even in your car. So it takes maybe 30 seconds, the whole process.
Interesting.
Okay,
Now,
thank you very much.
Can you answer, Avery, when it's not a chronic, when it's more of an acute?
Yeah, acute medication, immediate need. Like I mentioned before, it's immediate. You have a rash. I just like to use the flu because everybody knows how you feel on the flu. It's miserable. Mm-hmm. You don't even want to wait till the next morning in the mail for your medication. 10 out of 10 times, you drive straight from the doctor to your pharmacy because they send that antibiotic script to your local pharmacy. So we don't change your purchasing habit. You then take our membership card into that pharmacy that you've been going to your whole life. You present it. You're getting that acute medication, immediate need, antibiotic, whatever it is, for free. There's no copay. We're not insurance. There's no back billing. You're getting that medication for free.
Wonderful. And then I know you've touched on this. I just want to say it for clarity, because this was a confusion I had when I started testing the service. If it's not on the free list, which is all on the website, guys, then it's discounted at the local pharmacy.
Correct.
That's a contracted price, already contracted.
Yes. So we have the lowest contracted prices in the industry. On our program, there's 805 drugs, but technically in the broad span of pharmacy, there's a little over 4,000 drugs. A lot of them are loss leaders and whatnot. But if you happen to fall into that above 805 category, that was kind of that 10% that I mentioned. We have a special discounted rate that you can go pick up at your local retail pharmacy, or you use our patient assistant program through us. 9 out of 10 times we get a better price with that, and then we mail it to you next day for free.
Beautiful. All right, thank you.
All right, next up, we've got Michael Leary. You can go ahead and unmute yourself.
Good morning, David. Good morning, Avery. My question is for you, Avery. Do you know, does your program have application? I live in a state with a lot of military veterans, and I'm not sure how they fill their scripts. Is this something that would have application to them, or are they pretty much covered through the existing government programs?
Well, so that's a interesting question. So first off, everybody is accepted on our program. It doesn't matter if you can be the CEO of a Fortune 500 company, or you can be living on the side of the road. It covers everybody. You can be 1 year old. You can be 99 years old. There's no pre-authorization. Anybody can use it. We don't turn anybody down. Usually people who are in the military are going through the VA, and so they're getting a lot of stuff already covered. There are a lot of drugs on our program that the VA actually does not cover. So, you know, if you're talking to somebody in the military, they have the VA, but they want to use our program to augment it, they can do that. So it doesn't matter who you are, as long as you have a name, an address, and a credit card, you're authorized for the program.
Awesome. Thank you so much. I appreciate it. Love the program.
Of course. Thank you.
Thank you, Michael.
And next up, we've got Janet. You can go ahead and unmute yourself.
Well, first, I don't think that Wade was done with his questions, if you want to bring him back before me.
I think you're all right. He'll jump in if he needs to. Sorry,
Okay.
thank you, Janet. I think we got him though.
Okay.
If
So
not,
my question is, does the family include four-legged family members? I've been a pet sitter for 14 years, and you'd be surprised how many animals are on meds.
You know what's funny? We were just internally discussing that, and there's believe it or not, you probably know, you know, animals, about 80% use the same drugs as humans. So, you actually, yes, it does cover your four-legged friends, or I shouldn't say friends, family members.
So they won't balk at it being from a veterinarian versus a regular doctor
Oh,
or a human
no.
doctor. Thank you.
Yeah.
it's huge.
Right. Awesome. Thank you.
Thank you, Janet.
Great question. I didn't even think of that. Next up, we have Katie Sprinkle. You can go ahead and unmute yourself.
First off, I love this because
Thank you.
I am a psychiatric patient. I have depression and anxiety, and a lot of times I can't get my anxiety pills because they're like $700 for 30 days.
Yep.
And I have to make a choice there, and I don't want making that choice. So yeah, tonight, as soon as little man gets home, we're getting on the program.
Yeah.
I'm getting my pills, man.
Yeah.
But my question is, how do we set forth the transfer? I mean, is it, because right now everything's at Meyer Pharmacy. How do we
Yeah.
set forth that?
Yeah, so once you become a member, you have to be a member first. Either you can activate that, so you call our customer service team. There's a number, 800 number. You tell them you'd like to transfer your scripts. They put you in contact with the pharmacist, and then they just take it from there. It's about maybe a 3 to 5 minute phone call.
Okay,
Yeah,
All right,
very,
cool.
very easy to use.
thank you.
All right. Next up, we've got iPhone, and the number starts with 443. If that's you, you can unmute yourself. Oh, there we go. Go ahead, iPhone.
Hi, thank you. Good morning, gentlemen. My name is
Morning.
Barbara, and I'm loving the process from start to finish. But I had a client that came to me last night, and she's not able to purchase because of her insurance. She has overspent, and she needs this particular med. And because of the number that you're saying, and I don't know off the top of your head if you would know this, it's regarding weight. And the drug itself is Ozempic.
Mm-hmm.
And so she's wanting to know a price. And when she called me, I said, "You're not going to believe this." I said, "I'm going to be in a meeting tomorrow, a webinar regarding drugs." I said, "So I am so excited. I'm hoping I will be able to get an answer for you."
Yeah, I'm glad you brought that up because it seems like Ozempic and Wegovy and Mounjaro are really the hot thing right now. Obviously, it started as a diabetes drug, and now it's just taken off because of celebrities and whatnot for its weight loss ability. It is a brand name and specialty medication. We do have a special member pricing. I'm unable to quote that, but I can tell you that it is significantly less than what she's paying for it now. Usually, a cash paying consumer for Ozempic is about $1,200. I can't put it right on the number because we use a whole bunch of different patient assistance programs, but I can guarantee that it's at least 50% of that.
Okay. And so, having said that, and this being my first, I know I go into my back office to order this, but she wanted me to give her some type of pricing. So, guiding me, I should contact customer service first for her.
So actually, for stuff like that, we don't. If you just call into the program, we're unable to quote brand and specialty without you being a member first. So
Okay, so
she'd
I'm,
have, yeah, you or your friend would have to sign up, and then they're able to assist you.
so she would be not a family, and she would fall under the 1995?
Yeah, she would just sign up for an individual plan.
Okay, all right, then, thank you very much.
You're welcome.
By the way, that's one heck of a microphone on that iPhone. Sounds like she was in a studio.
Yeah.
So we have now Ginger, I believe.
Yes, Ginger Smith, you can go ahead and unmute yourself.
Hello, thank you for the call. This has been actually an eye-opener. I used to be in pharmaceutical sales, and I used to work for a wholesaler, so I understand how much they mark up the drugs because I was in the industry. So when he's saying that, I truly know the truth on that one. My first question was seniors. So a lot of seniors, unfortunately, at this time of year is in the donut hole.
Correct.
So my way of thinking, I used to be an insurance agent for 10 years, was if they get in this plan, and a lot of times they do hit the donut hole, and let's say they get their maintenance drugs through the year through this plan up to, it would help out when it comes to them not getting donut hole so quick, right? Because it's not being used to their Medicare or Part D, right?
Correct. This is a perfect program for that situation specifically, the donut hole.
Okay. And my other question, when you mentioned about contracted drugs, I'm surprisingly I'm on Humira, and
Wow.
yeah, I get it through a specialty pharmacy. I don't pay anything for it because of I have a autoimmune disease, and I remember when I sold pharmaceuticals, it was running at $14.5 a month. So if it's $1 down to $5, that's a lot less than $14.5. So when you mentioned about contracted pricing, how does a person know when they go to the pharmacy? Like I'm on also a blood thinner. I'm on Xarelto, and my husband's on Eliquis. How do we know the contracted price? How can we get the contracted price before we go to the pharmacy so we're not like, okay, how much do I need to bring to the pharmacy for this prescription?
Yeah, so you would call our customer service team, tell them about this situation. They would turn you over to one of our pharmacists, and they would help you. And you actually, I'm glad you brought up this scenario. You actually don't even have to go to the retail pharmacy. We get that for you. You pay with the card that you have on file, and we mail that to you. You can elect to go to the retail pharmacy if you'd like to, but we can also ship it to you if you'd like.
So that's because that's a maintenance drug as well.
Correct.
So you guys would just ship it out instead of having to go to Walgreens. Would that affect, so like the situation with my husband, he's older than I am, he's in the donut hole primarily because of Eliquis, and what she mentioned, what was that diabetic thing she just mentioned? The pen, the one that she was just mentioning.
Ozempic?
Yeah, he takes it for diabetes. He's not taking it for necessarily weight. So so when he joins, we will be able to know what the contracted rate for that is as well, because that's the issue we're having right now.
Correct. Yeah.
Okay. All right. Well, that's what I need. And how about groups? Are we able to sign up groups like employers and everything?
You are. Yes.
Do you guys do payroll deduction?
Do you mind repeating that last part?
Do they offer payroll deduction through employer groups?
Yes, correct. We can do that. They can voluntarily go out. The employer can just pay for it as an added benefit. There's a lot of ways to go about that.
Okay. Well, those are my questions. Thank you.
Great. You're welcome.
All right. Next up, we've got George Taylor. You can unmute yourself.
And while he's unmuting, let me just share, I think Avery's made it very clear. They've got pharmacists standing by. I mean, they've got a customer service team that can help answer questions, and I've tested it. I've called it myself several times, just asking, how do I get over the counter drugs? And just asking any type of question I could imagine that a customer might ask. They're very good. They're very patient. And if you need to talk to a pharmacist, they got pharmacists who can help talk to your doctor. If there's a drug that's not on the free list and they think, we might be able to move it over. So they're your advocate. They're like your local pharmacist, even though they're nationwide. And I think they do a category. Go ahead, Avery.
But before we get to the question, yeah, to expand on that, we have a 42-person seat call center, and these people only handle inbound calls. They're not salespeople, so they're here to educate you. It's not like when you call the cable company, 9 out of 10 times it's like you have a thorn in your side and it's a problem and you're frustrated. These people are here to educate, help you. They're very knowledgeable. They're really the face of our company because that's who the members talk to. So they go through a 30-day training process where they have to learn the drugs, how to pronounce them, all the different areas of the company. And then after the 30 days of training, they actually spend 10 days doing fake calls. So, they play games and they call each other and ask questions and all that. And their supervisor has to approve of them actually going out and handling a call. So these people are very friendly, very knowledgeable, and we don't just hire anybody off the street. You have to have a background in healthcare. So these people, they really know what they're talking about.
Beautiful. And that's your call center. Then you also have the pharmacist.
Yeah, so 42 person call center, which is, you call the 800 number, that's you're going to get first. And then technically we have 12 white coat pharmacists on our staff, and then a few dozen pharmacy techs.
And are they all out of Ohio there?
We are, yeah. So we're located, I'm actually sitting in the facility. It's a 32,000 square foot facility in Akron, Ohio. If anybody's familiar, it's 20 minutes south of Cleveland. And like I mentioned before, we're licensed in all 50 states and, shipping out to Hawaii, Alaska, California, Florida, everywhere.
Beautiful. And by the way, do you ship to Virgin Islands or Puerto Rico?
We do. British Virgin Islands, Puerto Rico, and Guam.
Wow. Love it. I know we get that question regularly. I'm getting a lot of texts about comp plan, guys. After Avery's done, I'll go into the compensation and some stuff. I'm going to hold that just out of respect for Avery's time. So we want to get only questions about the pharmaceutical program right now. If you don't have one about that, please lower your hand, and then we'll come back to compensation and such afterward. Who else do we have now? George, you unmuted, buddy?
Yeah, I think I'm unmuted now. My question kind of got answered by the last lady. In marketing to like an employee, or even though they're doing the payroll deduction, each person would have to sign up, or could the employer sign up each of the people that they're going to be paying for?
So both ways. Usually what we see is, there's an HR department or somebody there that's handling what we call an eligibility file. It's just a list of there's specific things that we need on that end from an employer standpoint to load you into our system. You get filed in as a group. So David's Restaurant, for an example, there's 30 employees there. There's an eligibility file. We get it. We know it's that group. We would bill the employer in that situation, and everybody gets the benefit.
Thank you.
We'll build an online intake form for that, George. Right now, we don't have that. We just have it set up for individuals, just like we did with the healthcare. Started as individuals, built the group plan. So, Avery, I'm sure we'll be talking about that and how we can get. We do have a lot of small businesses and groups that will probably want to sign up.
And I have one last question. My other question is, and I don't know if you know this or not. My wife at one time, she took insulin, so there was the Solar Star pens. But normally, and I don't know if the pharmacy controls this or the manufacturer, the pens would only originally be sold in groups of 5 in the box, which gets to be expensive compared to, I think, the least amount that you could buy is a box of 3.
I'd have to go back and get that answered for you. Unfortunately, I'm not a pharmacist, so I'd have to ask about that. But I'm taking a note of that, and we will get back to you on that one.
Yeah, that's a big thing. Okay, thank you very much.
You're welcome.
Love the program.
Thank you.
All right. Next up, we have Alan Bush. You can go ahead and unmute yourself.
Good morning. Can you hear me?
Yes. Good morning.
Okay, great. I got 2 things. I had just a recent comment, but now I had a question as well. I'll go with the comment first. My comment is, I'm glad Dave and your company got together, and I'm kind of have mixed feelings because you just exposed what the markup is in the pharmacy, in the pharmaceutical company. the pharmaceutical industry. I can't believe we knocked up the markup. So about 15 years ago, I just went and looked up on the drug list that you have this drug, Depakote, Depakote sodium. You do have it, and it cost me zero being a member. About 15 years ago, I used that medicine for my daughter for anti-seizure. I didn't have insurance at the time, but CVS was charging me like $650 for a month's supply. And I was at a point where I had to make decisions. I had to go sell stuff so I could get my daughter's monthly meds because the insurance has lapsed. Now, exposing this and seeing that, it's a shame that they have that such a markup and you have to make those decisions. But I'm glad you're here. Glad that program is here. And I'll be sharing it. It's unbelievable. And thank Dave for making the connection. That was my comment. I'm sure there was another lady that she was in the same situation. She mentioned something about psychotic drugs. So same kind of thing. They use it for psychotic and for anti-seizures here. But I'm glad that you expose them and that gives more value to what this program is and how it can help people. And I will be sharing that story. That's very personal. And
thank you.
And second is, now I have a question. Somebody mentioned the pet or four-legged friends. I don't have any four-legged friends, but my mother does. So if she goes to the veterinarian and they give her a prescription, would you do the same thing? She would give the card with the pharmacy numbers on it, and they could the script.
Correct. Yeah.
Okay.
Well, it works the same way, just as if it were you or I getting it for the animal.
Okay. Well, that's all I have, and I'm glad that you're here.
Thank you. Thanks for sharing.
All right. Next up, we have Ellen Nguyen. You can go ahead and unmute yourself.
Oh my goodness. I'm just almost speechless on everything that you've shared. This is just such a huge blessing to all of us and the people that we're going to be able to take it to. My question is, I was playing around with the website earlier doing some drug searches, and can you give some tips on that? Because I was able to find better on the formulary rather than the online search tool. Can you kind of walk us through that, Avery, and explain the best way to do that?
So the way that we set up our drug formulary to search, there's a couple ways you can go about it. You can type it in first off. You can go under therapeutic class, and now several of the drugs, there's 805, there's a lot. Some of them are in several different therapeutic classes. You can find it that way, or you can type in the brand name equivalent. So all these drugs at one point were, brand name, now they're off. Perfect example is Viagra. Generic name is Sildenafil. So if you type in Viagra, it's on our program as Sildenafil, but it'll come up and it'll show you Sildenafil parentheses Viagra. So that's kind of how you use a drug search. If that answered your question, it helps.
It did, yeah, absolutely, because I know we'll have that. And David, as I'm listening to Avery today, this explanation is amazing. Is there a way we can have this type of explanation clipped and available? I've watched the videos on the site, but nothing as in depth as what you shared, Avery. When we talk to medical partners and veterinarian offices and dentists and so on that might want to offer this to their clients, what you shared just really takes it home that this is a legitimate company. We've got the right heart behind this, and we're bringing a tremendous value to the client.
Well, I would say, as you know, Ellen, we'll take this clip right here, we'll use it, but I know Ellen's one of our top leaders, Avery, so she's probably recommending we do some sort of, if you don't already have a video, we create one that's designed just to take to businesses and consumers.
That's
where
easy.
we can get more concise.
We can do that. Or I would suggest, Ellen, if you have a blank check, I'll go to every single doctor's office and explain it.
I'd rather just have a video. It'd be more time for all of us.
I'm appreciate it, Ellen. And by the way, we're thinking group forms, right? I know she's helped a lot of groups come forth for our healthcare, so I'm sure she's looking at this for that. All right, who else do we have, Morgan?
Next up, we have V. Wright. You can go ahead and unmute yourself. Hello, am I heard?
Yes.
Happy Friday, everyone. A very good presentation, David and Avery. I had two questions for you, Avery, but you just answered one of them, which was going to be a very sensitive question, which was, are drugs like Viagra included? So thank you for saying that. And the second question is semi-sensitive as well, regarding the customer service people. Are they generally mother tongue American English speakers?
Yeah, so I'll go back and kind of expand on your first question, but the call center people, yeah, they're all Akronites. They all live in Akron, English speaking people. On the website, you can actually pull down and expand it into 5 different languages. And we also have Spanish speaking representatives available. So if there's anybody that speaks Spanish, and then if it goes into any other language besides English or Spanish, we actually have a automated translator system. Somebody asked us the other day if we do Portuguese, and actually the website pulls down into Portuguese. And if you speak Portuguese, you will not talk to a real person, but we do have an automated system that speaks Portuguese, just using that as an example. So hopefully that answers your question. But I'd like to go back to that Viagra. So yeah, we actually have Viagra, which is sildenafil, Cialis, which is tadalafil. We have the best men's lifestyle program in America. We have the hair loss drug, tadalafil. There's a lot of dills and ills and tongue twisting words. The hair loss drug. We also have the smoking cessation drug, so the drug that helps people quit smoking. We also have 16 birth control pills as well for females. So I'm sure the men out there see Romans and Hims and all those men's lifestyle programs that are advertising, and they say, hey, you can get a pill for $10. Well, that pill costs 2 cents. So they act like they are giving you a discount on your generic Viagra, but they just fall right back into the same games of the greed and inefficiency of the pharmacy industry. So now you're getting your Viagra and Cialis for free on our program.
Am I still unmuted?
You're unmuted.
Another sensitive question that dovetails into what you just said. Are any sort of gender transitioning drugs on your list?
No. So those are, you would get those like through a hospital. That's called institutionalized medicine. We don't do anything like that.
Thank you.
You're welcome.
Harlequin, we are ready for you. You can go ahead with your question.
Yeah, hey, thank you so much, Avery. We're super excited to have you with us.
Thank you.
A couple of quick questions for you. You were talking about with doing groups and stuff like that. If somebody does this as a payroll deduction, do you happen to know if that would then be considered tax deductible?
I believe it is.
Okay, that's awesome. And then how do you define a family member? Because I've got somebody who's got multiple family members that live with them. They've all got different last names, and then there's also who are, maybe not married, but they're living together, that type of thing.
Yeah. So on our system, what we qualify as like dependents is husband and wife, or husband, wife, as long as you're married. And children up until the age of 26. So even though we are non-insurance, that's our only insurance caveat. So if you have, 10 children and they're between the ages 10 and 20, they're covered. I myself, I'm 29 years old. So if I were living at home, unfortunately, I'm not legally a dependent anymore. So I would have to get my own program. My parents could get the family for themselves, and I get an individual. And then we get this all the time. If grandma and grandpa are living at the home, obviously they're over 26, so they would have to get their own. But if they're married, let's just say grandma and grandpa are living with mom and dad, they're a couple, they can get a family plan. But if grandma's at the house, she would have to get an individual plan, or a child over 26. We have
Has to be the
several
same household too, right?
in the same household, correct? Yeah. We have several families who have, I think we have one family that has 16 children. So we actually had to give them 3 cards to put all the children on, but you know, they're just paying one price, the 29 bucks for all 16 and they're all covered. So not 29 times 16, it's 29 once, covers them all.
That's awesome.
Yeah,
Well, thank you so much. Appreciate you.
you're welcome.
Thank you, Harlequin. Go ahead, Mark. Yep.
Next up, we've got Carmen. You can go ahead and unmute yourself.
Hi, thank you for all this information. I was wondering, my doctor, I'm only allowed to take one thing because I'm everything else over 50 medications. So I was trying to go on and become a member. Do I go through the regular site, or do I go through the agent resource site? And
Go to DAC. Cameron, all you gotta do is go to dachhealthcare.com, dachhealthcare.com, and you'll see flat fee RX. You click on it, hit subscribe now, and you'll be linked right into our partner's order form, but you can see the drug, look up there, you can look at everything right on the website. So dachhealthcare.com, it just went live last night. And you can also get to it from the David Allen Capital site, click on healthcare division, but for simplicity, just go to dachhealthcare.com.
Okay, and then if I want to give it a thing to my doctor and my dentist, because they like to tell you to go to the pharmacy, if I don't know how to do that, do I give them a thing with a QR code, or how do you do?
You'll have a membership card for getting your prescriptions filled, but if you're talking about for them to refer it, you would give them your replicated website.
Okay,
So,
all right.
your replicated website is where they would send people for you to get compensated on it. But if you're trying to fill a prescription, you'll get your membership card, you'll show them that.
So they can tell everybody about the David Allen Capital healthcare system.
You bet. dachhealthcare.com. And believe me, we're working on some marketing stuff to leave at the doctor's offices. I was talking to my doctor today. We do a Bible study together. I was just talking to him this morning about it. He's like, put them on my counter. So we'll be putting some hangers and different things. Wade and I have been talking about that for a while too. As long as it doesn't violate any laws, we're going to be marketing these hard, of course.
Awesome. Thank you, Carmen. Next up, we've got Cleveland. You can go ahead and unmute yourself.
Can you hear me?
Yep.
Okay. Question regarding when Dave was talking about earlier about shipping. Will the client get like a tracking number when their product is being shipped to them? So they're going to be expecting the item?
Yep. So back to the scenario when we ship it to you, and it takes about 30 seconds. We electronically get the order. It's filled in our pharmacy system, bagged. Once we use United States Postal Service, once the shipping guy comes for the day and scans your bag, immediately once the bag is scanned, just like anything you order, the member is then notified via email with a tracking number, and you can track your prescription the whole way, just like any other package.
Okay. Now earlier I heard you also mention something called donut hole. I'm not quite sure what that meant, by the way. So
yeah,
go ahead.
It's just for, it really just more applies to Medicare people.
Okay. I guess the next question would be for David. Will there be any type of drop cards made for this, David?
Yeah, no question. That's what we were talking about. We are working on some marketing stuff. So we call this our beta launch. It went live as fast as we could get it live. We got the website live, but now we're taking the next several days. We're already designing them. So we believe that's going to be an important part of this. Till then, we've got your replicated websites, of course.
All right. Thank you. Thank you so much.
You're welcome.
Thank you. Next up, we've got Cassie L. You can go ahead and unmute yourself.
Thank you so much. This is a great product. I was just wondering, can we, or a great program, I should say, can we market this to Medicare and Medicaid patients, or do they already have the best prices?
So usually they have pretty good prescription coverage already. I think I mentioned earlier though that there's a lot of drugs on our program that those programs don't cover. So this does not replace either of those, but if they happen to be one of those people that is on those drugs that they can't get through that, then obviously, they can use us and utilize it. But just so everybody knows, we do not replace Medicare or Medicaid.
It's kind of like the VA, same thing, same type of thing, right? They've already got great coverage, but that doesn't mean it covers everything.
Yeah.
All right, next
More
up. we-
questions for Avery, a few more.
Okay, Ruby, Jay, you can go ahead and unmute yourself.
So, hi, actually my question was that I am from Canada, so does it apply to Canada as well?
If I heard you correctly, unfortunately, we do not cover Canada. We only do the United States, British Virgin Islands, Guam, and Puerto Rico. I love Canada, but we can't ship to there.
But do you think in very near future it will be?
We get asked that a lot. So, every country has different laws. Canada has a completely different pharmacy system from us. As much as I'd like to go up there, the simple answer, and I hate to give it, but it's just the truth, is we'll never be able to cover Canada.
Okay, thank you very much.
You're welcome.
All right, next up we've got Roger D. You can go ahead and unmute yourself.
Hello, can you hear me?
Yes.
Hi, just one quick question. So once you become a member, are you locked in for a certain amount of time or can you cancel anytime?
No, you're not. So you can cancel anytime. There's no cancellation fee. But we actually were just telling somebody this the other day. So if you order, let's just paint a hypothetical picture here because we know it's going to happen. Somebody signs up today, they get their chronic medication, they're getting a 90-day supply, and then they cancel. Stuff like that happens. What's unfortunate for the member at that point is we won't reach out to them for a refill because they're no longer an eligible member. So they're getting that 90-day supply, but a chronic user, you're pretty much on that the rest of your life or for a significant amount of time. So you got that 90-day supply, or you went to your pharmacy and got that acute medication. But, if you were to turn around and try and get another chronic or an acute, it would get denied. So, but no, you can sign up this month, test it out. If you don't like it or you're not using it or for whatever reason, you can cancel and it's free.
Okay, thank you.
Yep.
All right, next we've got Alex P. You can go ahead and unmute yourself.
Yeah, I had a question regarding group coverage because I know that there are going to be both employers and employees that are asking, how does this affect their FSA money? How would they be able to gauge how much to put aside? And I guess you can only really determine that once they become a member, or how does that work?
Yeah, so we don't, since we're not a fee for service program, they actually don't use that with us. It's just, a cash transaction.
Okay, thanks.
All right, next up we have Jamar. You can go ahead and unmute yourself.
Hey, thank you so much for your time today, sir.
Thank you.
I'm a veteran, so I do get a lot of things covered, but every once in a while, there's something that's a little bit outside of the purview of the VA, so that can be annoying. And obviously, there's a lot of veterans who are dealing with some of this stuff, so this is incredibly valuable. My question is more of a, just from a marketing angle standpoint, this subscription sounds too good to be true. What do you say to somebody who's like, wait a second?
That is, what's funny? I'm so glad you literally said the exact words. Since 2017, there's only been one knock about this program, and it's that exact word. It's too good to be true. And like I mentioned in my, when I was giving the overview, there is no standard pricing, and we've just been conditioned for, centuries on pharmacy that this is just what it is. You just are stuck with this price, with this med, and you have, your arms are tied together. That's just not true, right? And we're exposing that and bringing it to light. I mean, there's really no other way to prove it than just to get on the program and see. You know, I guess back in the day when Amazon started, it was similar where people were like, well, this can't be true. You can't get your toilet paper and your produce and a book and a phone charger all in one day from the same place. You know, and now look how it's literally become our society. Amazon is our society. And it's really the same thing. So it's just we've just been conditioned, and it's nobody's fault. It's just how the world operated. But I'm glad you brought that up, because that's you'll hear that a lot from people, that, oh, it's too good to be true. Well, when you start to get your medication that you've been paying $400 or $500 a month for free, now you don't have to waste gas or time going to the retail pharmacy, and you're getting it for, you know, this extremely low cost. People never leave, and that's taking me to another segment. Is the retention rate for the program is through the roof. It's almost at 100%, because the program speaks for itself. You know, especially, we're all humans. If you, hopefully not a lot of people are on chronic medications, but we all get sick. Even if you've taken an Advil, that's considered a pharmaceutical. So we all feel it. We all know what the pain point is with the price and the access, and everything I talked about. So yeah, all I can say is, you know, sign on, see what it does, and the proof is in the pudding.
This almost feels like Netflix meets Amazon in a sense, right? Because we're getting a thing delivered to us at that subscription price. And what I would say is, David, you said $1 million by next year. I think that's a low stretch goal. I think we should have 3 to 5 million with how amazing this is. If we can just give people the right information and how to tell the story and send them to the right information, this is a no-brainer to at least try it.
Yep. You're exactly correct.
Thank you so much.
Yep, you're welcome.
Thank you. Next, we've got Jean. You can go ahead and unmute yourself.
Could you address quality control, particularly on the generics?
Well, this answers your question. You know, like I mentioned, we have a pharma economics team, 12 white coat pharmacists, pharmacy techs. We're buying all of our drugs from the same manufacturers at Rite Aid, CVS, Walgreens. These are the exact same pills. They're not similar or close. These are the exact same pills. If you're getting your Lexapro at Walgreens, and now you're getting it from us, it's the same exact pill. So hopefully that answers your quality control. Yeah, I hope that answers that question.
Great, thank you. Next, we've got Janet. Looks like you have another question. You can go ahead and unmute yourself.
Thank you. So continuing with the animals, going with the groups, I was born and raised in Ohio. In fact, I fly into Akron when I visit the family, but I'm in Texas now. We love our animals. So there are animal sanctuaries, like nonprofits. One is a horse sanctuary. They have 32 horses. Another is bears and exotic animals. So would they be able to sign up under their nonprofit and just be able to get, and just in case you don't know, the difference between a rescue and a sanctuary is the sanctuaries take in animals, they don't adopt them out, they just take care of them for the end of their life. Mm-hmm. Versus a rescue takes in any animal that's hurt or just needs a home, and then they adopt them out. So if you could talk about sanctuary and animal and rescue, that'd be great.
Well, you know, I'd have to get back to you on a lot of this. We don't currently have, like, I'd have to go in our system and figure it out, but there's not a ton of people really utilizing it for the animals. And obviously I'm not a veterinarian, so I know, you know, like I mentioned before, a good majority of our drugs cross over for a dog or a cat. I'm not sure about a horse or a bear or something like that. I don't think we have any grizzly bears on our program yet. But yeah, I'd have to get back to you on the animal stuff, because we cover it, but unfortunately, you know, we haven't really gone out there and been like, oh, the animals, you know, we try to capture the humans first. So I'd have to get back to you on that.
Right, because the nonprofits, you know, they have an owner of the nonprofit, so I didn't know if they'd be able to have their animals, even though it's 32 horses under a family plan, or how that works.
I'd have to,
Yeah, I think we can walk away from this assuming they're not gonna be covered.
Yeah.
Because
Okay.
it's almost like if Netflix said, I can use Netflix and I'm now gonna go use this Netflix membership to play movies in my neighborhood and sell tickets. It's like, it's made for a family to use for pharmaceutical. And if your dog has to get called for a blood thinner that's the same as a human, we can get it for them, but it wouldn't be, I can't imagine to be the case. So I would assume it's not gonna be covered.
They all have the same address, though.
Yes, that'll be the day.
Designed as a pet product is the point, right? It's not necessarily a pet product, but if you get a prescription that happens to be a human prescription for your dog, you know, you can get it filled.
I'll let you know when the horse types in his credit card and gets a program for himself.
And 30 horses at the stable, you know.
Yeah.
I love your Janet, I love your mindset though. You want to help people and you want to help horses and get the best value. Keep in mind, guys, just like Netflix pays for every movie, this pharmacy's paying for every bottle that goes out. So we're using the law of large numbers and saying by having a lot of members, some members I'm sure they're losing money on. And other members, they're making a little bit more profit. So we don't want to set up a situation where we're bringing losing customers to it, where they've got, 70 family members called dogs to cover it, because then eventually they'll say they can't do it, right? If we use into it. But anyway, who else we got? I know we got a couple more hands up. Avery, you still good on time?
I'm good. I can give you about another half an hour.
Okay, I don't think it would be that long because I can't get a half hour, but thank you, buddy. Let's see what else we got here and then we'll wrap it up.
All right, Trina, you are unmuted. Go ahead with your question.
Yes, hi. Thank you, gentlemen. I just had a quick question. I was wondering, do the coverage take care of anti-rejection medications?
I am unfamiliar with what that is.
That's like if somebody gets a kidney transplant, if they get a liver.
No, that all comes from hospitals, which is institutional medicine. We don't cover like treatments and stuff that a hospital would do.
Okay, thank you.
All right. Good question. Next up, we've got John Foster. You can unmute yourself.
Okay, my question is, you mentioned earlier that there was a couple of drugs that would be covered under this plan that Medicaid does not cover. Can you give me an example of what that might be?
Oh man, I know. Our largest therapeutic class is antipsychotics and antidepressants. We have 96% of the market share on that. I know there's a good majority of those on there that you can get through us that you can't get through Medicare or Medicaid. That's just one example.
Okay, got you. And would there be a cost share for those types of drugs, or some of those could be free?
They're all free. Yeah, if it's listed and covered on our program, the 805, it's free. Wow. You never, no since we're not insurance, and once again, like the Netflix model, go home and you never watch one movie today, or you watch 100 movies today, you never pay for the movie. We're the exact same principle.
So would that, some of those drugs you just mentioned, would that be kind of the same as some of the $400 or $500 drugs that you mentioned that some people could potentially get?
Correct. Yeah, okay. Like I mentioned before, duloxetine, if you're a cash paying consumer, and there was somebody else who was actually taking that drug, she knew that, it's several $100s at the retail pharmacy. On our program, it's free.
Great. And then one more question. This program kind of speaks for itself, but do you guys foresee any add-ons or any additional products in the future?
That's a good question. So every quarter, our pharma economics team goes over the database of drugs that were prescribed from the government. And every quarter, we're usually adding a couple drugs. We actually had a big jump last year where we went from 600 drugs to 805. Since our conception, we've never had a jump that big, but we're constantly adding drugs that are either coming off patent, which are a brand name drug that is, ending its patent and now becoming generic, or if something that is not really utilized is now more utilized, we put it on the program. And like I mentioned before, we cover every single drug that there is known to man, but that 805 just represents what people are actually using. So we're not necessarily looking to expand products. A lot of people ask us, for example, supplements. Well, we're a pharmacy company and we really focus on, the pharmaceutical needs. So we're not going to get down the road of supplements or stuff like that, but we do consistently add drugs to our formulary.
Okay, great. Thanks a lot.
Let's, Avery, let's do this just for sake of time, because I'm going to talk about compensation now. I know there's still, the hands keep going up, so I think we could go for hours.
Totally.
I just want to give you a chance to share any one last minute thing here, or last statement. And then what we'll do is we'll have anyone email us in questions. We'll check that. These are in the FAQs. We'll have them email them in, and then we'll have you on another time. We'll take some more questions, and we'll get all the questions answered through emails, folks. So is there anything you want to say, Avery, in wrapping up before I go into compensation a little?
I think we covered a lot today. A lot of these questions were awesome and, were very necessary. So thank you all for that. Thank you, David, for partnering with us. Obviously, you see the vision and, what we're trying to achieve here by getting Americans affordable access to prescription meds. So I just want to thank you for that. And I pretty much covered everything about the program. So whether it's getting on another Zoom or I don't know if you have my email, I can get it to you. If anybody can send me an email. I'm young, so I use this thing a lot, and my father makes fun of me that I email off of it. It just works better for me than a computer. So anybody can email me with a question, and I respond pretty quickly. So open to that as well.
Wonderful. Well, we'll share that in our Facebook group rather than here. And but folks, keep in mind you got the FAQs on your website. You can look at drugs there. You can find out if a drug's available. That's the common question. Do you cover this? How do I get a price on this? The price is available for members. So it's kind of, well, how do I know if the membership's worth it until I'm a member? Well, many of you are going to be members. You can find out the drug prices yourself on some things. But hey, listen, Avery, you've been fantastic.
Thank you.
I've talked to Les, and we're really excited about how quickly you guys moved to make this partnership happen. And I'm going to be meeting you down in Akron here soon. It'll probably be after the Ohio State game. And hopefully I'm coming out with my tail between my legs, but hopefully I'm coming with my tail sticking way up in the air.
I'm neutral in the situation, so whoever wins, that's who I'm friends with that day.
Right on. All right, well, thank you, Avery. I'm going to go through some compensation stuff now, but hey, what a great presentation. And Elle and I agreed we could take some clips from this. And
thank you.
Thanks a lot, buddy.
Yep.
All right, so compensation, guys. Can you see how many millions of people? I agree with what Tamara said. When I said a stretch goal of 1 million members in 24, obviously we can ripple much faster than that, but we can also fall flat on our face because it comes down to, even if a product is remarkable, if we're not remarketing about it and we're not sharing it, it doesn't matter how good it is, right? And sometimes it can come off as too good to be true. But the reality is it's not. There's a great need. Millions of people in America are overpaying for prescriptions right now, and we can get it for free. And it's going to come a day when this will be the standard. It's not yet, but it will be. And we're going to help make it a standard, and that's the key. And our agreement, guys, survives any mergers or acquisitions, so you don't have to worry about this company becomes the giant thing, goes public, and doesn't need DAC anymore. Our agreement survives all that, so you're protected, and for the life of the customer, not just year one, not just year two, for the life of the customer. Now, first mover advantage. We're the ones who are going to bring this forward. You probably haven't heard of anything like this before. And I did hear one company talking about this a while back. They're charging a lot more, and I come to find out they're being provided the service by My Free Pharmacy, who we've partnered with. So we've already had some people, I'm sure, consider, well, maybe I should go direct to Free Pharmacy. They're not allowing that, of course. So you guys are protected there. If you tell your team about this, you don't have to worry about people circumventing us. This is a family run business, but very successful, and they like what DAC stands for. We're honored to be partners of theirs. They're honored to be partners of ours. We're excited to make this happen. That's why we went with the co-brand rather than our own brand. And we like the idea of flat fee pharmacy because you pay one flat fee and get all your prescriptions free. We know it doesn't include every prescription, but it includes most. And if it doesn't include yours, we might be able to get you moved over to one of the ones it does include, because a lot of them are the same type needs. So their pharmacists can do that, though. We don't have to worry about that. It's not for everybody, but it's for most. Not for everybody, but it is for most. And you consider the savings on the over-the-counter drugs alone. It's spectacular. So even if someone goes, I may spend that much a month, well, okay, well, now add up all your over-the-counter stuff. You get half off on that, too. Oh, wow. Yeah, flu season alone, or cold season alone, and Robitussin, and antacid, and Zantac, and all that. Get half off all that. It starts to add up. You go, wow, $240 a year for a membership to do this for an individual, or $360 for a family. In fact, it's cheaper if you buy it all at one time, an annual plan. So let's talk compensation. There's $10 of residual revenue goes into the pay plan on the individual plan and the family plan. Okay, they're both the same. It doesn't matter which plan they get, we're compensating you the exact same way. So it's $10 residual revenue. If you have 10 customers, you're at 100 residual revenue. If you're at 20, you're at 200 residual revenue, etc. You get anywhere from 20 to 50% of residual revenue, as you know, on your personal commissions. So, and then you get paid on all the residual revenue and commissions of your team, right? So the long and short of it is you make between 20 and 50% of residual revenue of $10. You're making $2 to $5 per customer per month, depending on where you're at. $2 to $5 per customer per month. You're not going to get rich by signing up 100 customers, right? 100 customers, you'd be at 1,000 residual revenue. You'd be making $500, about $500 a month. It would actually be under 50%, you'd be at 40%. You'd be about $400 a month for signing up 100 people. So you're not going to get rich off that, and they pay for a car. Where this helps you get wealthy is in the same way they're not making a lot of money per customer. They're making less than you are per customer. Someone pays $20, you're making more. You are the highest paid person in this transaction. You're making more than DAC, you're making more than the pharmacy. You're making the most of that $20. So nobody gets rich off one customer, you get rich off volume. So what we're excited about this is the volume that will happen in your team. We believe our free business will attract more reps than any other business. We've already proven that to be the case. And then when you add to it the amount of revenue that will be generated from this giveaway type product, this membership product, and the retention rate of this membership. I've had Netflix since it came out with CDs in my window, and I think, I don't know how many years ago, that was about 20 years. I've been paying a Netflix membership every year for 20 years. I don't even think about it. It's like a utility. Guess what? People who are on chronic medication pay for it every month. They don't even think about it. You're going to sign a customer up, but they're going to be on this longer than they're going to be on their mobile phone. Here you go from AT&T to Verizon to this one to this one to this one. This will be the go-to source pharmacy. We're marketing a pharmacy to them, including over-the-counter medication, including free medication. So this is good. This is a game changer. And so where your compensation comes from is now you start getting into hypothetical examples. So I just want you to imagine something. Forget every other product for a minute. Forget all the other products just for 1 second, which is not a real. It's not a reality because we have all the other products, but just forgetting all of them for a moment. If all we had was this product, and I think our average will be 10 to 15 customers per rep, average, because we'll have someone get 40 or 50. Do you know with our incentive, you want to get to 1,000 residual revenue in your first year to get all the big bump ups, to get that lifelong raise. So you want to get to 1,000 residual revenue in your first 12 months. If you had 100 customers on this, you're there. If you did nothing else to get 100 people on this, that's a lot of conversations. I get it. I had a person start working with us recently. He's called 400 businesses in 3 days. You go, so calling 100 people about this would take time. It would take time, but could you do it in a year? Could you, if you talk to 200 people, you probably have 100 who this is a better product for them. So yeah, it's going to take time, but if you didn't do that, if you average 10 customers a person, heck, let's say you just average 3 customers a person, 3 customers a rep, that's $30 in residual revenue a person only. But you have 1,000 people in your team. 30,000 in residual revenue coming in every single month in residual revenue. Now you have all the incomes on that, and then you get your percentage. So we're going to have hypothetical examples to show you how you can get to 6 figures on this product alone, residually, where you're making over $8,000 a month residually. It's not going to be that difficult. I will tell you this: in a pay plan that paid out about half what we pay out on a product that generated about $8 in residual revenue. We had people at 6 figures a month, 8,000 a month in 9 months, 10 months of just exponential growth of people averaging 3 to 4 customers each. It doesn't take a lot of customers. So I know I'm not giving you a lot of details. If you want to make a big paycheck, it's called funding. Funding. That's where you want to make a check with a comment this week, it's funding. If you want to make a big residual check, you need something viral. You need something that has ease of getting 7 or 8 customers. There's nothing easier than this I've ever seen. This is the easiest product to get 7 or 8 customers on than anything I've ever seen. And so everything else out there, whether you're talking about mobile phone, it's a commodity. I can get a better deal at AT&T. I can get a better deal at Verizon. I can get a better deal at T-Mobile. I can get a better deal at Line. I can get a better deal at this. I can get a better deal at that. Okay? And they're all right because it depends on which promotion's being run. Meal replacement shake? Well, I can get a better deal at Costco. Yeah, but their ingredients don't have the this and the this. But this one's got sugar alcohols, and this one's got this and this. Well, this one's all carnivore. This one's they got this and this and this. And it's very difficult to take a person and give them the willpower, the knowledge, and the confidence to talk to strangers or their warm market about a product that is easy to pick apart. You can't pick this apart. This is what you could say: my drug's not covered. Okay, it's not for you. It's like saying, I only want to watch sports documentaries and Netflix doesn't offer any. Okay, there's no reason to have Netflix, right? So it's really easy for someone to say, this isn't for me. Check the drug list. Is it on there or not? If they're on there, let's roll. If they're not, then don't do it. You don't need to sell anyone. It's real simple. It's very simple. So there's nothing that competes with this. There's nothing that's doing this but us. The other ones doing it are using the same provider we are, but they're putting it in their own name and charging more. So we can move them right over. They can pay less by getting it through us. And nobody knows about this. There's nobody who's aware of this. None of your warm market is aware of flat fee pharmacy. Are you kidding me? So he or she that wants to get out there and talk, think about this for a minute. Big upfront money, biggest in the industry, David Allen Capital. 95% will never get a funding though, or the customer. But if they do, they can make big money right away. Okay, great, fabulous. What about my 100 reps who can't get a funding customer or don't want to talk to someone about a business? Can they get a pharmaceutical? This here, folks, is game changing for DAC. This will make DAC one of the fastest growing direct sales companies in North America. This product. We've been trying to get a product like this for 6 years. Because we know our funding is the best funding platform. We know our comp plan was free, and the way we do things is the fairest, no renewals, no website fees, the free app we got coming out. We do things right. We're disrupting the way direct sales is done, but we just needed that consumer product because 9 out of 10 reps won't market business products. They can, but won't. They'll market a consumer product. So what this is going to do to your team, some of you have 100 people on your team, they need to know about this product. We'll start coming up with hypothetical, we got incentives we're launching in December about this product. You start getting customers now, they're going to count for the incentive. So become a user yourself immediately. Just get it done. Get signed up for it immediately. If you value your family, sign up for it immediately. And you order it right from your back office. You'll be not from your back office, from your website. You'll be a customer of yourself. You go to your replicated website, dachealthcare.com/RX/your ID number. Every one of you should have that on Facebook already. Every one of you should. Every one of you should be using it if you could use it. Everyone you know needs to know about this service. You got videos on the website. Start telling the world about this new innovative pricing model. They don't know about it. And when you see the incentives we got to drive the numbers, all you're going to want to do is go get a certain number of customers in this. It's not because of what you make on those customers, it's because you're helping them. But when you have a team of 100 or 200 or 1,000 or 5,000 people do that, it's game changing. It's literally wealth creating. So all I want to share, other than Complan, is it's all based on residual revenue, just like all their other services. The difference is the average payment processing customer will produce about 30 residual revenue. This produces about 10, but this you'll be able to get about 70 to 80 times as many customers than someone can in payment processing. Love payment processing. Love it. Love it. But if they're only doing $10,000 a month in sales, how much residual revenue is there on that? So this, you get one person, one family, there's 10 residual revenue. And if they get the annual plan, you have 110 this month. So if someone got a customer tomorrow on the annual plan, they're already qualified for 110 this month, residual revenue. Next month it'll be 0 unless they get another new customer. But base everything on the residual revenue, start running hypotheticals on that, start getting customers now, start sharing, well, Dave, I need more education. You've got this video, watch it again and again and again. What do we do? Have you heard of DAC's flat free pharmacy? No. You pay, it's like Netflix. You pay one low monthly price, you get all your prescriptions free. Really? Yeah. Does it cover this and it? I'm not sure. The list is on the website. Covers most every prescription. Some it doesn't, but most every. Just like you don't get every video on Netflix, you get most all the great videos, but you don't get 100% of them. You should check it out. Our website's got, I'll send you a link. You can see the list of the medications right there. You don't even have to tell me. It's right on our website. You can look through the list right there and see if it's there. If so, get the membership. Save you a lot of money. And the website explains everything more than that. And yeah, we'll come up with videos to share. We're coming up with more marketing stuff. But that's all you need to know. $10 residual revenue. You don't make 10. That's the residual revenue. You make 20 to 50% of that. And of course, if you recruit me and I'm going out and getting customers, I make what I make and you're making a percentage of what I do. So it can be very lucrative. And you'll have examples of this as we roll out into our December launch. This is pre-launch for the next 2 weeks. Again, they sign up today. They'll get their welcome letter tomorrow at 4:30. You'll see them in your back office tomorrow afternoon. Okay? Let's go to questions about compensation if you have any. And then we're going to end it.
It looks like we've got a few hands up.
Okay.
Ginger Smith, you can go ahead and unmute yourself.
Thank you. So can you kind of, you said 20 to 50%. So can you break down where the 20 and the 50% comes in, and in regards to like overrides, is that like the override side, or can you kind of break that down? What determines 50%? If I sell it directly, what is my percentage? If I bring in somebody and I get percentage over them, can you kind of break that down?
Absolutely. I'm going to do one better. I'm going to pull up our comp plan chart. Okay, so I can't share my screen right now, unfortunately, but on the compensation plan chart, which is in your back office, you can pull this. You earn 20 to 50% of residual revenue based on your personal residual revenue. If you only get one customer, you're making 20%, unless they're doing a lot of volume. So every month there's residual revenue created by your personal customers. The more personal customers you get, the higher percentage you earn on all those customers. So you make 20% no matter what. But then you have bonuses. Once your residual revenue is over 200, you start getting up. Once it's at 400, you're making 25%. So 400 residual revenue, you're now making 25% of all your residual revenue. 600, you're at 30%. 800, you're at 35%. 1,000, you're at 40%. 1,500, you're at 45%, and 2,000, you're at 50%. So you would need, if this was the only product, you'd need 200 customers to be at 50%. You'd be doing 2,000 in residual revenue, you'd be making $1,000 a month. By getting 200 customers on this, you're making $1,000 a month. Forget your team. That's just your own personal revenue. But you wouldn't just be making 50% on this residual revenue. You'd be making all the residual revenue of what you do. As an example, I'm over 2,000 residual revenue already from payment processing and healthcare and other services. Okay, so I'm already at 50%. If I go get a customer tomorrow on this, I'm making $5 every single month at every customer I get because I'm already at 2,000 residual revenue. So it depends on how much residual revenue you already have from your other services. But the chart is in your back office. And not only if you get to the 50% residual revenue, you also make that as a match on anyone you personally enroll. So whatever your personal residual revenue is, let's just say you're at 40%. If you're at 40%, that means you make 40% enroller match of the income of anyone you personally enroll. So by getting more personal customers, not only do you earn more on your own residual revenue, but you also earn a lot more on your personally enrolled reps. You get that percentage of their income. So if I'm at 40% or 50%, I'm making 50% of the residual commission that my frontline's making. They're making $1,000 a month, I get 500. If you're at 50% and I'm making $1,000 a month, you're making 500. So what we do is we've created a driver here that says, climb up the personal residual revenue ladder yourself because you'll earn more on your own, but you'll also earn a lot more on the people you personally enroll. So, and that's not counting the 7-level pay, that's not counting area director overrides, that's not counting coding pay, that's not counting car allowances, that's not counting expense allowances, that's not counting travel perks or revenue sharing or equity. That's just, if we had nothing but our affiliate plan, which is personal customers get you paid and personally enrolled agents you get paid on. If you just stop there, you don't need any of the other stuff to be able to make a 6-figure income here on this product alone with just personally enrolled agents and just everyone shooting for that 2,000 residual revenue, 100, 200 customers over time. Now, I know most people won't do that, but hey, if my doctor's office is ready to put a business card in his facility and he sees thousands of patients every year, how many of them will benefit from this? I don't know. What if just 100? What if only 50? Well, 50 times 10 is 500 residual revenue created by a conversation because he's helping people save money on their pharmaceutical. And all I did was have one conversation. So you can see how big this can get. You will have people who take this and just have cards and sit at, conventions and stuff and just talk about the residual plan and sign up hundreds of people in a weekend. So this goes back, this garners back to the days back in the long distance days or when cell phones were brand new and people were marketing cell phones or people in colleges marketing credit cards and they go give away 30 credit cards a weekend to college students who've never had a credit card. This is that type viral product where people get hundreds of customers. When we had long distance, I remember I got 800 customers in a weekend just talking to people about saving money on their phone bill. 800 customers in a weekend in front of an event. This type thing will have those type numbers. So the chart is in your back office. It's page number 8 of the compensation plan, which will show you your residual revenue. And one other thing I want to say is if you get to 1,000, then we'll take your question. If you get to 1,000 residual revenue within 12 months of starting with us, you forever are positioned to get a 25% raise. Whatever residual income you earn in 7-level pay, you get 25% more because you hit the 1,000 level in the first 12 months. So people haven't read our comp plan or haven't watched our video. What they don't realize is they're missing out on a permanent future raise that has a deadline of the first 12 months. So hopefully that answers your question. If not, ask a follow-up.
Okay, so I have 2 more questions and I'm done. So I can't find my email with my back office stuff. Surprisingly, I've looked through my emails and can't find it. Is there somewhere I can email to find that information with my thing or whatever?
Yeah, email support@DavidAllenCapital, support@DavidAllenCapital.com, and just tell them you're looking for your user ID and your email on file. They're going to give as much information as you can in the email, your name, your address you've lived on, because we've got a lot of people with the same names. So please give as much detail as you can so they don't have to verify different things. For those of you who can log into your back office, whatever email you got the email telling you about this event is probably the email you use when you join. So if you try to log in, I guess you need your agent ID to log in. So yeah, you you would have to know your agent ID. But so just email support at David Allen Capital, and they'll send your ID number, and you can log into your back office.
And this is my last question. When is the residuals paid out on the enrollments? Is it paid out the next month, or let's say I got
paid out on the 15th of the month. 15th of the following month for the month prior. And we're working on maybe going to the personal commissions faster for people, signing up customers to get their personal portion quicker. But for qualifications, as of right now, it's the 15th of the month for all residual revenue. Of course, the bonuses are paid next day. Someone gets the funding today, you're paid tomorrow. So those are real time every day, but residuals are paid on the 15th of each month.
All right, next we've got Carmen. You can go ahead and unmute yourself.
I have been going through your David Allen Capital thing under Health Share. I couldn't find health care and I couldn't find how to sign up. Can you help me?
So yeah, go to dachealthcare.com, dachealthcare.com, dachealthcare.com. So Morgan, if you could type that in the chat, dachealthcare.com, or Tyler or Sharon, anyone else, and then Carmen, you can just click on it. That's where you go, dachealthcare.com.
And Carmen, if you have any other trouble, of course you can reach out to us at support and we can walk you through, but I will leave that in the chat as well. And next up, we've got V Wright. You can go ahead and unmute yourself.
Am I heard?
Yes, you are.
A request. So when you guys start putting together the marketing materials, please consider making a Connect card, if you haven't already thought about this, that on one side has the health share and the other side the prescriptions.
Yep. We're probably going to have, our vision is to have something that looks like a prescription card, because for doctor's offices and stuff, it'll be a standalone marketing piece, but then yes, a Connect card, healthcare card, which would be both.
Okay.
And the good thing about digital is, because we're not teaming up with a printer who has, prints they need to create, plates they need to create, you're limited in design. Because we're just doing digital, we can have multiple designs and make them available. We don't have to worry about printers saying, hey, I don't want to have 4 different versions. So for us, it's creation time. But once it's created, it's digital, and you guys pick the ones you want to print. So I think you'll find that we have more options as we move forward, more suggested options. And of course, anyone can take themselves and have one design. We just need to approve it if our logos are used on it in any way.
All right, and Michael Du, you can go ahead and ask your question.
Hey, David. This is a positive comment, actually. My wife, Barb, and I have been in the discount drug cart business for 15 years. We've had our own discount drug cart. We were basically run out of business by GoodRx because they're so big. The comment I want to make is that for everyone to understand, there is nothing more residual than you will ever do than this. This is the most residual product you'll ever find. And I just wanted to give that positive comment. And I think that the next biggest thing is the marketing material you provide us with. We have been in literally hundreds upon hundreds of doctor's offices leaving discount prescription cards. So if we have good marketing material, this is a no-brainer.
Well, Michael, it sounds like we should talk. Sounds like we should talk to make sure. We'd love to borrow from your experience if you're willing to share it.
15 years.
Yeah. So if you're willing to share, we're willing to talk, and let's make some great things happen together.
Absolutely.
All right. All right. We'll go to a couple more questions. The only reason I'm saying that, guys, is my internet is out, and so I'm connected to my mobile Verizon phone for internet. Comcast is out in my area, and my phone, I'm being told I've only got a few minutes left. So plus I've got a 2 o'clock appointment anyway, so we got to bring this home. Let's go with Ellen and then Alex. I think those are the last 2. Is that right?
That's right. Yep. Ellen, go ahead, and then we'll go to Alex, and then we'll finish out.
Awesome. Thanks for calling on me, David. I just wanted to share something real exciting with you guys. While I've been listening to questions, I've sent out about 10 text messages to my immediate family and some of my closest friends. The text was, hey, between you and your spouse or your family, are y'all spending more than $30 a month out of pocket on prescriptions? Or if it's an individual, hey, are you spending more than $20 a month out of pocket on prescriptions? And I'm getting responses from every text that I have sent out. Those that are saying yes, I'm just saying, hey, I've got something I want to share with you that'll save you money. So I've already got people in the funnel just from sending that simple text message out. Man, this is going to be a game changer. Get on it. I love it.
No question. I love it too. Thank you for that, Ellen. And folks, that's all it takes. Send some text. Alex, you'll be last for us today. Then we're going to wrap up something.
Yeah, just wanted to ask a quick question regarding the marketing material. Are we going to have some sort of like PDF or a trifold that we can bring out to, you know, whether it's a business or a doctor's office per se, and then like demo videos we can show while we're there, that kind of thing?
Yeah, so we've already, on your website, there's already some videos that explain more, Alex. Great questions. My free pharmacy, our partners, given us a whole resource center of their stuff already that we can co-brand and make available quickly. We're telling everyone we'll have the agent resource ready December 1, just for under promise, over deliver rather than the other, which we have a habit of sometimes. I have a habit of. So we're already working on that stuff, and we were using proven stuff that has been used already. But then there's stuff like what Michael Du said, and he's been doing this a long time. So we're going to hear other ideas and put some things together. And then our app that's coming out will also have some marketing materials in it. So yes, we plan to give you everything you need and improve on that as we go. Just like, you know, our funding platform, it started with here's your application, to have them fill it out and get bank statements and send them to us. And now it's all 100% online, right? And it's all real simple. You send a text. So we'll get better and better as we go. But for now, you've got a replicated website. It was created. It converts already. It was built by My Free Pharmacy. I shouldn't say that. We built it in-house. Tyler has been building this for the last week, and it's all live. But every piece of information that we use, videos, the text, everything came from our partner. They gave it to us. This is what converts. This is what works. This is what helps explain the product. So you're not basing this on, you know, a couple months of effort by me or our internal team. This is based on years of conversion by our partners. This is built into our website. We've even used their color schemes or color themes and co-branded to that rather than ours. So we'll get better at tools, but what we have already is converted thousands of customers already, or more. I don't know the exact number. And I know this, we're going to help convert millions with it. So hang tight, but you don't need to wait for more. You don't need to wait for more marketing materials. Ellen sent a text. It's a pretty common sense thing, and that wasn't the diabetes medication. That wasn't over-the-counter drugs. That wasn't, well, what if you get the flu and you got to go get a prescription? Are you currently spending more than $20 individually? Are you currently spending more than $30? And that attracts people. This is an attractive product. Get the word out. Start commenting to people. Start approaching people. Send them your replicated link. It's already live. David, DAChealthcare.com/RX/your ID number. Share away. All right, folks. Stay tuned. Monday, we're going to have more information for you. We'll have a great weekend going into Thanksgiving week. What a blessing. Let's see who can get the most customers on this weekend.